So the next muscle in our series is Sartorius. This is a muscle that you may have learned about in school, completely forgotten about, or may never have learned about in the first place, but it is a very weird and cool muscle that has a lot to do with both knee issues, hip issues, and low back issues. And so we're going to cover where it attaches, what it does, and how to work on it easily. Sartorius attaches right down in here, and in your anatomy book it looks like it attaches right to this spot called the anserine, and that it's this very clean attachment. However, in dissections, the fascial attachment for Sartorius can run all the way down to the middle of the tibia, so just keep that in mind. Generally, when you see these very tight attachment points on these very long muscles, from a physics standpoint, it makes no sense to just anchor here. You're going to have far more control if you can anchor all the way down, right? And so fascially, even though we see it in our books as attached right here, and that the anserine is this little circle on the medial side, medial to the tibial tuberosity, the tib tub, in actuality, the fascia from the Sartorius can come all the way down to here in dissections. And so that's just one thing to keep in mind. However, we can really use that anserine as our landmark. And the Sartorius, so it attaches here and then comes all the way behind the knee, crosses over, and on some people it crosses sooner, some people it crosses way up by the hip, but you can really think of it as this loop that comes all the way across and comes up to the ASIS. All right, and that is called Sartorius because it is Latin for sartorial, which actually has to do with suit making. And the reason they would call it, we call it the Tailor muscle because, let me see if I can get this on camera. So if I activate just Sartorius, it is going to both bend the knee in that loop and externally rotate. And this is something that suit makers do for some reason or another. I don't know why they stand in this position, but that's why it's named Sartorius, is that the actions it does is this: bend the knee and externally rotate. All right, so coming back to the muscle itself, we can think of that again. This lower portion that loops back here would bend the knee, and then the upper portion that loops around from medial to lateral, if you can imagine that contracting, is going to pull the whole femur laterally and into lateral rotation. So there's all the attachments, what it does. To work on it fascially, I would say, because it's the most surface thing on the quad, to start at the anserine and just trace it fascially. It's going to be very close to the surface, and it's going to be very thin. On some people, it is technically the longest muscle on the body. On other people, rectus femoris actually wins out and is slightly longer, and it really depends from person to person. And it's a very long and thin muscle. And so it doesn't have a lot of power, but it's got a lot of length to it, so it really can draw this whole thing from here to here together and out. Now, in our modern day, we have a lot of folks who are sitting with their knees externally rotated a lot and sitting in chairs bending all day. So Sartorius itself is going to start to lock up to be able to hold that position a little bit easier. And so doing some fascial work like I'm doing just to lengthen it out and trace it is going to help undo some of that and allow the leg to relax more and be more easily useful in standing and walking than it would need to be in sitting.